Hey everyone, today we're going to have a conversation that might completely change how you think about sex education, not because the topic itself is new, but because there's a very real difference that most people overlook, the difference between sex education and sexual health education. Now, you might be thinking, wait, aren't they the same thing? That's what a lot of people assume, but the truth is, while they're related, they're not the same at all. In fact, understanding the difference between them is the first step to improving the way we teach, talk about, and understand human sexuality. Let's start with what we usually call sex education. For most of us, this is what we learned in school, usually sometime between late primary and high school. It's the class, or sometimes just a few awkward lessons, where they taught us about things like puberty, reproductive anatomy, menstruation, ejaculation, and maybe how babies are made. If we were lucky, it also included a bit about STIs and contraceptives. In some cases, there was a brief mention of consent or even a slide or two about sexual orientation and gender identity. But in most traditional sex education programs, the emphasis is largely on biology and reproduction. Now, that's not inherently bad. Learning how the body works is important. Understanding the mechanics of sex, pregnancy, and protection matters. But sex education in its most basic form tends to be very clinical and very limited. It's often focused on preventing negative outcomes, like unintended pregnancy or STIs, and doesn't always explore the emotional, mental, or social aspects of sexuality. It's like giving someone a driver's manual and teaching them all the rules of the road but never actually showing them how to drive in real-life traffic. The information might be technically correct, but it's not complete. On the flip side, we have something broader, deeper, and far more useful in the long run, sexual health education. This approach goes beyond biology and addresses the full spectrum of what it means to be a sexual being. It includes everything you'd find in a good sex education program, but it also dives into topics like communication in relationships, emotional readiness, body image, boundaries, identity, pleasure, and even navigating peer pressure and media influence. In other words, it doesn't just teach you how sex works, it teaches you how sexuality fits into your life as a whole human being. Sexual health education recognizes that sexuality is not just a physical function, it's a core part of who we are. It influences our relationships, our self-esteem, our health, and even how we see the world. It understands that people are diverse, different genders, orientations, experiences, and values, and it respects that diversity by creating space for honest, inclusive, and non-judgmental learning. Let me give you a few examples to help highlight the difference. In basic sex education, you might be told, here's a condom. Use it to prevent pregnancy and STIs. In sexual health education, the conversation would go further. Here's how to use a condom correctly. Here's how to bring it up with a partner. Here's how to deal with the fear or awkwardness of that conversation. And here's how to respect your partner's response. Here's another one. In sex education, you might hear, wait until you're ready to have sex. In sexual health education, you'd explore, what does being ready actually feel like? How do you know if it's your decision or someone else's pressure? What are the emotional consequences, and how do you talk about them with someone you trust? Even something like consent, something that's often mentioned but rarely unpacked, gets a much deeper treatment in sexual health education. It's not just no means no. It's about understanding mutual respect, ongoing communication, nonverbal cues, power dynamics, and how to respond when someone changes their mind. It's about creating a culture where people feel safe to express their needs, limits, and desires without fear of shame or rejection. And this is where the impact becomes clear. Sex education might keep someone informed, but sexual health education helps them feel empowered. One gives you knowledge, the other gives you skills and confidence to use that knowledge in real life. So why does this matter so much? First off, we live in a world that's saturated with sexual content. From movies and music to social media and advertising, we're constantly surrounded by messages about sex, but most of them are incomplete, unrealistic, or downright harmful. Without the tools to interpret and navigate those messages, people, especially young people, are left confused, misinformed, and often ashamed. Sexual health education helps fill in the gaps, correct the myths, and give people a safe, supportive space to learn and grow. Second, the stakes are high. A lack of proper education can lead to serious consequences, higher rates of unintended pregnancy, STIs, sexual violence, and even mental health issues tied to shame, guilt, or trauma. Comprehensive sexual health education has been proven time and again to lower these risks. It doesn't encourage young people to have sex earlier, contrary to what some believe. In fact, studies show that people who receive full, honest, and inclusive education are more likely to delay sexual activity, use protection, and communicate better with their partners. Third, sexual health education isn't just for teenagers. This is lifelong learning. Think about it, your needs, questions, and experiences around sexuality change as you grow. From puberty to dating, from navigating your identity to starting a family, from dealing with body image to coping with menopause or erectile dysfunction, sexual health education supports you at every stage of life. It's not just a school subject, it's a foundation for lifelong well-being. So where does that leave us? It means that if we really care about people's health, happiness, and safety, we need to shift the conversation. We need to stop settling for outdated, incomplete models of sex education that barely scratch the surface. We need to start demanding comprehensive sexual health education that sees people as more than just their body parts, that sees them as whole individuals deserving of respect, information, and support. And we all have a role to play in that. If you're a student, ask questions and speak up when the curriculum feels lacking. If you're a parent, create a space at home where your kids feel safe talking about their bodies and their feelings without judgment. If you're an educator or policymaker, push for programs that go beyond the basics and actually prepare young people for the realities of life. And if you're just someone who wants to learn more, never stop exploring. Read, listen, watch, and connect with others who are doing the work of making sexuality education more inclusive, compassionate, and real. The bottom line is this: sex education teaches you what sex is. Sexual health education teaches you how to live with your sexuality in a healthy, respectful, and fulfilling way. And that difference? It's huge. So next time someone asks, "What did you learn in sex education?" think about whether what you learned really helped you understand yourself, or just scared you away from certain outcomes. Think about whether it made space for your emotions, your questions, and your identity, or whether it just gave you a diagram of a reproductive system and called it a day. Thanks so much for spending this time with me. If this video gave you a new perspective, go ahead and hit that like button. It really helps the channel. Subscribe if you haven't already, because we've got more honest, open, and empowering content coming your way. And hey, drop a comment below. What did your sex education look like? Did it go deep, or was it all surface level? What do you wish you'd been taught? Let's keep the conversation going. Stay curious, stay respectful, and most of all, stay informed. I'll see you in the next one.